Cancer is often described as a battle, but very few people actually understand what happens inside the body when this disease reaches its final stages. It's not sudden. It's not one single event. Instead, it's a slow collapse of the body's internal systems, caused by cells that refuse to follow the basic rules of life. Understanding these mechanisms is key to appreciating the seriousness of the disease and the focus of current medical research. 1. The primary threat, metastasis and organ failure. The most frequent way cancer kills is through metastasis, the process of spreading, and the subsequent destruction of vital organs. Metastasis and organ overload. Cancer cells are inherently malignant because they can detach from the primary tumor, travel through the bloodstream or lymphatic system, and establish secondary tumors in distant sites like the lungs, liver, or brain. As a tumor grows within an essential organ, it compresses, displaces, and ultimately replaces the healthy, functioning tissue. Respiratory failure, lungs. When tumors consume the space needed for oxygen transfer in the lungs, the body can't absorb enough oxygen. This leads to progressive asphyxiation, oxygen starvation, the most common cause of death in lung cancer patients. Systemic failure, liver pancreas. Extensive tumor growth in the liver shuts down essential metabolic and detoxification functions. Tumors can also cause deadly obstructions. For example, blockage of the pancreatic duct can cause digestive enzymes to become trapped, leading to the pancreas essentially digesting itself, which is why pancreatic cancer is so lethal. 2. The body's defenses collapse, infection and bone marrow suppression. The second major cause of death in cancer patients is infection. Cancer itself weakens the immune system, and treatment often compounds the problem. Compromised immunity and chemotherapy. Chemotherapy targets all rapidly dividing cells, including the healthy cells in the bone marrow, which acts as the body's factory for blood components. This damage leads to a severe drop in blood cell count, resulting in 3 life-threatening issues. 1. Anemia. A lack of red blood cells causes insufficient oxygen to be carried throughout the body, stressing the heart. 2. Neutropenia. A loss of white blood cells, neutrophils, leaves the patient unable to fight off common pathogens. A simple bacterial infection can rapidly escalate to uncontrolled sepsis, blood poisoning, which is often fatal. 3. Thrombocytopenia. A drop in platelets prevents blood from clotting, making internal and external bleeding uncontrollable. In some cases, like leukemia, cancer cells directly infiltrate and crowd out the bone marrow, achieving the same critical failure. 3. The metabolic drain, cancer cachexia. Finally, many patients suffer from cachexia, an active wasting syndrome. This is more than starvation. It's a metabolic disorder caused by toxins released by the tumor. The cancer toxins alter the body's metabolism, causing rapid involuntary loss of muscle mass and fat. The body's vital muscles, including the heart muscle and the muscles needed for respiration, waste away. This muscle loss severely compromises organ function and often leads directly to fatal heart or respiratory failure. Cachexia contributes to up to 30% of all cancer deaths. Conclusion and comfort. In summary, cancer kills by physically destroying and obstructing organs, crippling the immune system, and exposing the body to lethal infection, and inducing a catastrophic metabolic wasting that leads to organ failure. It's crucial to know that while cancer is a difficult battle, advances in palliative care ensure that the focus can always shift to comfort and quality of life. Good pain control is available and guaranteed. Experts confirm that strong pain medications like opioids are safe and vital for relieving suffering, and they do not hasten death when used properly. If you or a loved one are navigating this journey, always prioritize communication with your medical team.